Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. We'll be speaking with Juan Mejia. He's joining us here as president of NewYork-Presbyterian's Brooklyn Methodist Hospital and as the executive lead of the system's LGBTQ plus task force. He's joining us to talk about the impact of change a C-suite leader has within both the hospital and the surrounding communities. Welcome to Health Professional Radio, Juan.
Thank you. It's great to be here today.
Tell us a bit about yourself and talk briefly about your role at NewYork-Presbyterian.
Sure. As mentioned before, I'm the president of the New-York-Presbyterian Brooklyn Methodist Hospital. I've been in this current role in Brooklyn just for about 2 months, but I have been at New-York-Presbyterian Hospital a little over 20 years. I've actually had a number of different progressive leadership roles over the last 20 years. Most recently, I was the chief operating officer of our hospital located in Lower Manhattan and led that hospital for the last 5 years. But I'm excited to join the Brooklyn team. I've actually been here in Brooklyn, as I mentioned before, as the president of Brooklyn Methodist Hospital for 2 months, and excited to be part of this team. A fun fact is, Brooklyn itself, if you were to take Brooklyn outside of New York City, Brooklyn by itself would be the 4th largest city in the United States. So it's a huge population here and a great opportunity for us to really drive great care for our diverse population in Brooklyn. So I'm excited to really be part of the Brooklyn team here over the last several months.
What's the most meaningful aspect of your work at NYP and working in the healthcare industry more broadly?
This is actually something that I talk to a lot of our staff about on a pretty regular basis, whether it's our physicians, our nurses, our security officers, our housekeepers. And it's really a privilege to be able to walk into a hospital and work alongside our clinical team and a lot of our support staff to be able to make an impactful difference for our patients. We have patients that come in every day, have many chronic conditions, patients that are really dealing with different illnesses, and it's great to be able to be part of New-York-Presbyterian to be able to drive great care for our teams. Our focus is always to provide high-quality care and to ensure that we have optimal outcomes for our patients, and that's really our true north, ensuring that we're always improving the quality of our patients. And the other really, I would say, meaningful part of the work that we do is ensuring that we keep an eye on health equity and the care that we deliver, not just here in Brooklyn, but really throughout New York City. And as you mentioned earlier in the introduction, I am one of the executive leads for our LGBT task force. And in that work, I work with a number of our leaders from different departments across the organization to ensure that we have very clear policies, that we ensure that we have community programs that we're supporting throughout New York City, very specific to our LGBTQ patient population, and also importantly, ensuring that we have a lot of training for our frontline staff so that they're able to care not just for our LGBTQ plus patient population, but really for all the diverse populations that we have across New York City. And being able to drive that work, especially in New York City, is really meaningful. And really, at the end of the day, it's really great to be part of this team, again, alongside our nurses and doctors, to continue to drive the delivery care, ensuring that our patients have access to care. And as I mentioned before, ensuring that we're always talking about health equity to ensure that it's having a positive impact for all of our patients across New York City.
As talking about how your role expands into the community, not just in the hospital itself, describe maybe one or two current programs or maybe initiatives that you're looking forward to implementing as you serve these underserved communities and more.
Sure. So we have many initiatives that our community team works on throughout the hospital. And there's really two that come to mind that are really impacting our communities, one that we've done for a while, one that is a newer program that we're starting in the coming year. The first program is called the Embrace Program. And through a partnership with Caribbean Women's Health, high-risk patients of color are connected with a doula who provides support for expecting mothers. And in this program, the doulas conduct social determinants of health assessments and connect patients to additional services such as home delivery of health foods or other needs that our patients need, which is really important for our patient population. A second program that comes to mind is a program that we recently are launching in partnership with the New York State Department of Cancer Services program, where we have a grant to increase the amount of screening that we have for our communities, screening for breast services, cervical or colorectal cancer screening, And the goal in the coming year is to roll out this initiative. We're going to start working with a number of community-based organizations. And the goal is to increase outreach and ensuring that we're increasing the screening services for our population at the end of the day, with the goal of increasing the number of early detections of cancer so we can have patients access to care and ensuring that we're reducing the mortality rate for cancer. So those, again, are two examples of many different programs that we're doing here in Brooklyn to connect with the community.
As the executive lead of your system's LGBTQ plus task force, which healthcare trends do you see as the greatest opportunity for your team and your hospital as well to lead the way as far as change and diversity goes?
Well, I would say that first, as the president here at Brooklyn Methodist Hospital, it's important that we understand the clinical needs of our patients, so that as we're continuing to increase the number of services that we have, ensuring that we are growing our services, whether it's services related to cancer care, women's health, cardiology, and ensuring that we're continuing to grow the portfolio of physicians that are providing care in the community. It's also always important that we understand the health outcomes that are disproportionately impacting our communities, so that we continue to build programs. As I mentioned before, I gave two examples, but continuing to work alongside with our community to build these programs so that we can create links within the community over to our patients. And at the end of the day, providing high-quality care is our goal, and so ensuring that we have systems in place to continue to improve the care that we have and improve the access to all of our patients in our community is really our goal. And it's really a privilege to work here with the team, not just here in Brooklyn, but really throughout New York City, to make sure the New-York-Presbyterian Hospital remains a high-quality system, again, with access to all of our communities for care within our hospitals.
Is there anything that you'd like to add for our listeners? And then if there's a website where we can learn more, please give us that information.
Sure. I think having a conversation just around equitable care is an important dialogue that most hospitals, if not every hospital, should be having around the country. And it's definitely, as part of our mission here in New-York-Presbyterian, an important topic. And it's really great. I've been in Brooklyn now for 2 months, but it's great to be part of this team that has really continued to drive excellent care in Brooklyn. And there's a lot of work that we're going to continue to do, a lot of plans that we have for the community in the years to come.
And a website, if you would.
Our website for the hospital is www.nyp.org.
Juan, I appreciate your time this morning. Thank you so much for joining us here on Health Professional Radio, and hopefully you'll return.
Thank you for having me today. I appreciate it.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Juan Mejia. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.